Cold and flu season is in full swing as people spend more time indoors with the colder weather. But this winter, doctors are seeing even more viral illnesses than usual, from cold and flu and upper respiratory infections to COVID and more. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about what to do if you have symptoms and the most common issues ear, nose, and throat specialists are seeing this winter. With me today is Dr. Abby McEwan, an ENT at St. Luke's Health System. Thanks so much for joining us.
Yes, of course. You're welcome. Thank you for having me.
So, Dr. McEwan, first, can you just tell me about the trend that you're seeing this winter?
So this winter, and specifically compared to last winter, what we're seeing is that a lot more patients are coming in with symptoms of an upper respiratory infection. We think that that's probably because as mask mandates were lifted and patients are more comfortable gathering in larger social settings with vaccinations and things like that, they're just being exposed to all the bugs. So they're coming in with colds, sinus infections. Specifically in the pediatric population, we are seeing a lot more ear infections as compared to last year. RSV, tonsillitis, you name it.
So how can someone differentiate the symptoms of a cold, COVID, or an upper respiratory infection?
So that's where it gets tricky. Specifically between a cold and COVID, there really isn't a way to tell. There's no single symptom that can differentiate between the two reliably. And so the only way to really know is to get a test. And we certainly encourage patients to do that, either a home test or having a test done at a St. Luke's facility. Because until you have that test and you know if you have COVID or not, it's basically COVID until proven otherwise. Yeah. Specifically with sinusitis, again, really difficult to tell the difference between that and COVID. The difference between a cold and a sinus infection kind of comes down to the timing of symptoms, but also what type of symptoms that we're looking at. So with a sinus infection, usually patients will have symptoms for a little bit longer than the average cold. So about 10 days or more, and that's when it kind of starts to develop into a sinus infection for some patients. It also kind of depends on what type of symptoms you're having. Specific to a sinus infection, patients will typically have symptoms of kind of thicker, cloudier nasal drainage. Mm-hmm. Sometimes it can be discolored. It doesn't have to be. Facial pressure and pain, that's a pretty specific sign that there could be something going on within the sinuses. And then also nasal congestion. So those are kind of the three main symptoms that we'll look at that are more specific for sinusitis.
Okay. Now, as an ENT, what have you seen with people who have lost their taste and or smell due to COVID?
We've seen a lot of patients come in after having COVID with diminished sense of smell and taste. And so, that's a problem, not only just quality of life day to day, not being able to taste your food, but it also is a safety concern because we rely on our sense of smell to smell smoke, chemicals, things that can be hazardous. And so when we see patients in the office, typically they have been symptomatic for probably, at least 4 weeks or so. Most of the time, within a few weeks of having COVID, those symptoms are going to go away completely on their own. But if they don't, then it may be time to see an ENT. And things that we can offer patients in the office is basically a nasal endoscopy, where we take a really good look at the structure of the nose, the anatomy, see if something is identifiable that could potentially be reversible. Measures that we can take are instituting like a saltwater spray in the nose or possibly Flonase or a topical nasal steroid. Another thing that we're encouraging patients to do is something called smell retraining therapy, where basically all you do is take some essential oils or spices or something that smells strong and kind of smell those a few times a day to retrain your brain. And so that is something that has been effective for some patients. And then there are things beyond that sometimes we'll do, such as prednisone or systemic steroids. It kind of just depends on what we find on examination.
Okay. So what other ear, nose, and throat issues do you see with the cold and dry weather this time of year?
One of the big things that we see is nosebleeds. So again, with all of the furnaces on, the air is so dry. And so the nasal lining that's really fragile tends to get dried out and it bleeds. So Usually patients are able to manage those symptoms on their own at home, getting those nosebleeds to stop. One of the things that we'll encourage patients to do is basically nasal humidification. So putting a humidifier at the bedside, using a saltwater spray in the nose, which is safe and usually pretty effective. But when those symptoms persist, if you're having frequent nosebleeds, more than once per week, or if it's difficult to get them to stop, it may be time to see an ENT so that we can evaluate and see if further intervention is required.
Okay, and how does the cold weather impact people this time of year?
So another thing that we see, particularly in the winter, is patients who come in with runny nose, which is common, but something that we will see in specific patient populations is something called vasomotor rhinitis, which is basically kind of nonstop drippy nose. A lot of times cold air is a trigger for that. There are other triggers such as spicy foods, certain chemicals, things like that. A lot of times avoiding those things can be helpful, but patients can't always do that. And so sometimes they'll benefit from evaluation and certain interventions.
Great. Well, thanks so much for joining us.
Yes, thank you for having me.
To schedule an appointment or learn more about St. Luke's ear, nose, and throat specialists, visit stlukeskc.org/ENT. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.